From third grade to about seventh grade, I wore glasses, and I did have to stop playing a few sports because the risks of glasses breaking. I can't be rough that much with glasses. It kind of made me not really happy because I couldn't do things that I loved.
It was hard to see him go through that. I wanted him to be happy and to feel that he was able to do everything everybody else was. You put your family first, you put your kids before you. I did research myopia more than I had in the past, and really understanding that with the way that Matthew's eyes were progressing and how fast they were getting bad, as he got older, there were other things that could happen with his vision. I mean, we have one set of eyes.
The long-term risk factors of myopia, high degrees of myopia when it reaches 6 or more, is central vision loss with myopic maculopathy, cataracts at a younger age, glaucoma, which is peripheral vision loss, and retinal detachment. You can lose permanent loss of vision.
So when I found out about my sight, I was like, oh my gosh, this needs to be handed out to every parent out there who has kids in glasses.
The reason we chose MySight for Matt is we know that he was progressing and his myopia was already moderate. MySight is the only FDA-approved treatment that helps slow down the progression of myopia and control as best as possible.
So when we went back for his year checkup and his vision hadn't changed, I was ecstatic. I was, I guess, kind of emotional.
There's no safe myopia. Once myopia starts, it needs to be treated as soon as possible. Glasses don't really help slow down prescription. At this point, the best tool is MySight.
Getting contacts definitely boosted my confidence with just doing what I used to do, and it just helped me get back to my normal self. With the glasses, I just saw a box around my eyes and everything, but the contacts are just like new pair of eyes.
Hi, welcome to another episode of I Own a Business, where we focus on helping practice owners grow the practice of their dreams. I'm your host, Dr. Steve Vargo, and I have with me Christine Schneider, who is co-founder of RevCycle Partners, and John Kettner, who oversees all the compliance and IT for the business. So before we jump into the topic, I just want to give you both an opportunity to introduce yourself and maybe just briefly explain your role with the company.
Absolutely. I'll go ahead and start. My name is Christine Schneider. I am the Vice President of Operations with RevCycle Partners and co-founder. I myself have about 25-ish years of billing experience. Put together RevCycle Partners, an amazing team offering outsourced billing services to the optometry industry.
Perfect. And John?
My name is John Kettner, and I actually do the HIPAA compliance and the IT side of things for RevCycle Partners. I've been with them about 10 years or so.
Great. Well, thank you both. It's great to have you here. And what we're going to cover a few different things here. RevCycle Partners, if you're not familiar, and hopefully that'll come through as we continue our discussion here, but among a few other things, they offer a service for practices looking to outsource their billing. And the more I hear from doctors who tell me they are burned out or they've got too much on their plate, or they'll say, I want to grow my practice or I want to add a specialty, but I don't have time, the more I realize how many doctors are just spinning too many plates. And it begs the question, what should we stop doing? And I certainly think billing belongs in that discussion. So we can certainly get into that as we move along here. But something that doesn't come up a lot that even got me thinking was the HIPAA ramifications when you do start outsourcing your billing. So, the question of what do I need to know about HIPAA when I outsource my insurance billing? So let's start with this. What would you say, just starting with the most basic rules, what are some of the most basic rules regarding HIPAA compliance for an eye care practice? And then we'll build that out in terms of how that applies to specifically to insurance billing?
Well, one of the things you want to do is you want to make sure that your local laws aren't stricter than the federal law. A perfect example would be California actually passed a privacy law that is stricter than HIPAA. It's called the California Confidentiality of Medical Information Act. One of the differences there is that any business that provides a software to doctors, software or hardware, I'm sorry, they're considered a healthcare provider. Another example is if there is a violation, instead of just getting a fine from the HHS, the patient who had the issue actually could sue the provider as well for compensation, attorney fees, and damages. So that's the one thing you want to do with the local laws, make sure, but then you also want to make sure you know what a HIPAA identifier is. Those can be combined to create what is known as the PHI. When PHI is the protected health information, there is a list of 18 to 20 identifiers such as social security number, names, date of birth, email addresses, social security numbers, things like that. If you combine them all into one, that gives you your identifier so you can easily identify who a patient is. The problem is this list is over 20 years old and hasn't been updated. So as things develop, you just need to make sure you use common sense also.
John, let me ask this: your role as it applies to the billing aspect of it, is that something that would be something that the doctor would be expected to know and take care of, or is that something that outsourcing your HIPAA, your billing, would that be taken care of by a third party? For a lot of doctors listening to something like that and thinking that that's like a foreign language to me, is that something they should know and understand? Or, to my point before, doctors spinning too many plates and outsourcing things like billing, outsourcing things like HIPAA, is that typically something that would be under the expertise of a third party?
Typically, you actually, each office has to have their own, each practice has to have their own HIPAA compliance officer. So while I handle our side of it, the doctor's office is responsible for their side and their patient protection.
Got it. Okay.
I think it's fairly unique too, for an outsourced service to have, somebody in a position like John is, where he is strictly monitoring all of our activity that we're doing on behalf of the practice. He's putting in measures to ensure that we are protecting PHI, whether it's something to do with email or whether it's something downloaded onto our computers. He's going through and also making sure that the equipment and the necessary protocols are established and in place too, so that we are always keeping an eye on the security and the importance of HIPAA for our customers, who are practices, who in turn have their own patients, which are customers as well.
In terms of making sure that patient data is kept secure, yeah, I think we all know that. Most doctors know that. And a conversation I had years ago, actually, with a HIPAA compliance expert made me realize how complex HIPAA was. So a lot of people are just looking for the easy fix. How do I do HIPAA training for my office? Where can I buy a HIPAA compliance manual? How do I go about making sure that things are secure? But I realized after talking with him that it probably does make a lot more sense to look outside of your office in your area of expertise for help in this particular area. But I'm curious, from your perspective, maybe coming at it a little bit different than a pure HIPAA compliance company, because we're dealing with a lot of data when it comes to insurance billing and personal information, identifiers, and things like that. So what policies would you say should be in place to make sure that patient data is kept secure?
One of the things you want to make sure is that you limit access to the data and who has access to that data. I think, Christine, did you have a thought on that also?
Yeah, to your point, Steve, I think it's really good too for doctors to pose a question to any type of outsourced service that they're going to partner with to understand what they do and what their policies and procedures are. But some of the things that we want to make sure that our customers understand is limiting the access that we have, right? So if we are Monday through Friday, we should only have access to the EMR and the PMS Monday through Friday during business hours. Um, reviewing what levels and roles and things that you're creating for user access as well. For example, like our service coming into a customer's EMR, we don't have to see all of the financials. We don't have to see all of the orders and other things around the practice details, right? So I think doing reviews and understanding what types of access is needed for outsourced, but also reviewing that for in-house as well, because it affects both levels.
So, John, it sounds like your role is pretty heavily focused in this area of compliance, and you're kind of the go-to at RevCycle when it comes to these areas. But I don't know if every practice has that. You mentioned every practice should have a HIPAA compliance officer, and some practices may not know that. So if we could go down that road a little bit, you've kind of covered how you handle things at RevCycle and gave a couple examples. But for a typical practice in terms of HIPAA training, can you speak to that? What employees should be involved in training? Is that everybody? And what are some of the best practices around HIPAA training? Because this is something that I'll get asked a lot. How do I set up a training program for my staff? And they're trying to do it themselves. But if you could speak to that.
Sure. So for the HIPAA training, every employee every year has to do some sort of HIPAA training. And then once that's done, you have to keep record that they did it. And you have to keep that record for approximately 6 years. And for us, for example, we use a program we use called KnowBe4. And just because it's with our size, it's easier to set up the testing, the programs, and training through them. But you can also go online for the smaller offices and sometimes just find a simple, just download this is what your HIPAA training is and here's how you document it.
Where do things go wrong with that? When we see people get dinged or fined for HIPAA, what are where are the areas where practices make the mistakes on the compliance aspects?
The big one is thinking HIPAA doesn't apply to them for some reason.
I think what John means to say by that is not understanding the true nature of HIPAA and the secured methods in which you need to handle patient data. In general, we see a lot of offices will email us with patient information. They'll have the patient name, they'll have the date of service, they'll have claim information on there, things like that, but they don't send it to us in a secured fashion. So understanding how to actually, get information to another source, whether it's to us, whether it's to another provider, making sure that you do have a secured email path to do that. Faxing is another thing too that we run across as well, where an office may want to send us an EOB and they'll be like, well, what's your fax number? Well, we do have a secured faxing service in place that we can, send and receive data, but oftentimes the practice doesn't. So it's making sure that people really are thinking about HIPAA and actually applying it to them in everything that they're doing for the patient. I also think too, for myself going into a provider's office, I see a lot of times where staff will be typing in a patient chart and they don't log off, or they leave their access code open for somebody else to be able to continue on, inside of that program. And, it's very important to make sure that anytime you walk away from your computer, even working from home, that you lock it or you sign out or shut down of, what you're doing, especially around patient data.
some great examples of things that probably typically go wrong, where I think if you walked into any practice, you're probably going to find some things that violate HIPAA, even if it's just mild. And I don't know if you work closely enough with doctors from this in this context, but have you experienced areas where doctors were fined or were penalized? And I think what a lot of doctors wonder is, how bad is it going to be? I think there's impression, and maybe this is where you were going before, John, was that, there are still a lot of doctors who think that the HIPAA is for the bigger entities. It's for the hospitals. It's for the bigger healthcare clinics, that they're not really going to catch me. So has there been an emphasis with HIPAA compliance on the smaller practices? And feel free to say this is not our area that we focus a lot on, but what have you seen in terms of the penalties for doctors? Is it a slap on the wrist and some corrective action, or is it, assuming it's not overly egregious, do you have any feedback on that?
I actually don't have a whole lot of feedback. I generally try and stay away from the getting fined part. I have seen the stories where the big hospitals get fined, and there's the occasional couple of doctors and they get hit pretty hard. But other than that, I don't see a whole lot of it.
I recall a case not too long ago that we had posted for our team, and we use those as a reminder, an example of, be careful. We are representing, the doctors, the patients, and what have you. Here's, a situation where a doctor was involved in something, or the office was involved in something, and, there were fines associated to that. I believe it can range from a slap on the wrist all the way up to lots of money, right? But I don't think we hear a lot, about the smaller practices. On occasion, yes.
Yeah, and I think it's worth noting for the listeners that there typically is a process. So if you do something that you find out after the fact was a HIPAA violation, and I've seen that, I've taken those calls before where we accidentally faxed out or emailed things that we weren't supposed to email. There is a process in place. It's not my area of expertise, so I really couldn't speak to it, but we put people in touch with the right groups or organizations that were able to guide them through that.
Mm-hmm.
On the vendor front, I think even looking internally at our own HIPAA compliancy, we work with a lot of outside vendors as well. Most practices do. How do we, I think maybe some just assume that everything is above board in terms of HIPAA, but when outsourcing key functions of a practice's operation, how does a practice actually know or ensure that its vendors are compliant?
Well, one of the things you want to do is you want to make sure that you have a BAA signed, which is a business associates agreement. That basically, the short version is, it basically just says you and the vendor you're working with agree to protect the patient's privacy and do what you need to do that. Then there's other steps that should be done, such as virus protection on computers, because obviously you get malware, ransomware, you're gonna run into trouble there. You want to make sure that you can make sure the compliance training is up to date. There's nothing wrong with saying, when was the last time you did it, or has everybody done it? Just an example for us, before when we hire a biller and go through training, we make them do their HIPAA training right away up front, so that we have that compliance. We have to bring it up or anything like that. Just some things like that.
And John, bringing this full circle back to insurance billing vendors, which is really where your focus is, what would you say are some specific compliance issues that would need to be monitored for outsourcing insurance to a billing vendor?
You want to make sure that all their computers are password protected. Obviously, you don't want to just let it be wide open, anybody that walks in the door, wherever you are. You want to find out if they have secure faxing and email. Make sure that they have any policies in place for downloads and what happens to those downloads once they're done with them. The other big one that is, you want to make sure that there are like written documentations, policies regarding things like compliance and procedures. So, yeah, and you're more than welcome to always ask the vendor. They should be able to give you that information.
I think one other point too is making sure too that we're using a secured password manager. When we're dealing with hundreds of practices and, literally thousands of different portals and sites and different programs, right? It's, ensuring that we have the right programs in place to, keep that protected, keep that safe, keep that stored.
So some great tips here for working with vendors, even outside of insurance billing vendors, but I think some great takeaways here for both looking at your own internal processes, but also making sure that steps are in place for the outside outside vendors that you work with, and making sure that everything is above board in terms of HIPAA. So, well, thank you both. I appreciate your time. Where can people find out more about RevCycle Partners? And maybe I've had John doing most of the talking here, but Christine, if you don't mind, maybe just give people a little bit of information on what we focused on HIPAA here today, but what are the core services that RevCycle Partners offers your clients?
Certainly. So RevCycle Partners, we can handle your medical and or vision insurance billing. We have a credentialing service that handles projects, but we also have a maintenance offering for doctors that are looking to offload that completely. And then we also have an insurance verification and benefit service. And if anybody's interested in getting in touch with us, you can certainly check out our website. It's www.revcycle-partners.com. You're welcome to also email me, which is cschneider@revcycle-partners.com.
Perfect. Well, thank you both so much. Thank you, Christine. Thank you, John. And we've been a great partner for us. You're a partner of IDOC, and I've had a few different meetings with your company and very impressed with your services. So I really encourage anyone who's interested to reach out and check out that website. So thanks again for your time.
Thank you.
So if you would like more information about IDOC and how we work with ODs to help them grow their practice, you can find out more at our website, idoc.net. That's IDOC.net. So thanks again to my guests here today, and thanks everyone for listening.